You alluded to the antioxidative pathways. Now, antioxidants are hot, if you will. I mean, everybody's talking about them all the way from patent medicines through these very highly specialized drugs. Is there evidence that antioxidative pathways make a difference?
So there's no clinical trial evidence that presents any kind of convincing data to say you should take this vitamin or that vitamin, or for that matter, dimethyl fumarate as an antioxidant. That said, there are data that suggest that oxidative metabolism in nerve cells and axons has a role in why they tend to deteriorate over time in this disease process. And therefore, it's enticing, intriguing to think that working on oxidative metabolism might have a role in protecting tissue over time.
Again, it's all
but we don't have any data to really support that.
But not proven
currently
in people with MS.
Right.
Okay.
I mean, it's tantalizing too when we think about, we've done a pretty good job at preventing relapses and at preventing inflammatory lesions with all of our medicines. What we haven't had with such success, obviously, yet is the prevention of disease progression, the gradual accumulation of disability that happens in many people with MS, not everyone, but many. And so I think that is the big category of unmet need. We have all of these relapsing remitting medicines. It's a plethora. We have too many things to choose from to even discuss. But when a patient comes in with clearly long-standing progressive MS, we don't have those options, and the difference is really striking. So I think the idea of oxidative pathways, antioxidant pathways, and others that could be truly neuroprotective, irrespective of their immune modulating properties, could be a hope for progressive disease, but we need to see that kind of trial data before we can really use that more liberally.
Yeah, there's been accumulating data about oxidative stress and mitochondrial injury playing a factor in the neurodegenerative component of MS, which underlies progressive MS. And there are now preliminary trials that are looking at agents that might impact on that. Not proven yet, because progressive MS is a big lack. The interesting thing is we can talk about a dozen different damage mechanisms in MS. And which is the principal one, which is the key one, we really don't know.
And are they the same in each patient?
Exactly. They may not be, or at different stages of the disease, yet you hit one and you can seem to have a home run. Like anti-B cell therapy seems to be terrifically effective and very, very promising, and that shocked people. Who would have thought hitting B cells might be an effective treatment for relapsing, even progressive MS?
To be clear, none of the anti-B cell treatments are FDA approved yet.
Is this the voice of our conscience over here to the...
But it is kind of exciting. But we haven't identified the critical damage mechanism.
The other thing I keep hearing when I listen to all of you is, again, not being a neurologist, but someone who sees this disease, maybe it's not one disease. Maybe it's a mixture of different mechanisms, and maybe not all MS is the same.
That could very well be.
Well, it certainly doesn't behave the same in each patient. Whether or not it's a syndrome with a sort of a common pathology, meaning that it's caused by different agents or different mechanisms, we don't know.
All right. Well, we've all been